Hello, ladies and gentlemen. Good morning, good afternoon, good evening, wherever you are tuned in to this podcast. And this is another podcast on process control in the podcast series of Quality Management System Essentials. And today we are going to be discussing sample management. At the end of this activity, you will be able to name sample collection errors that could lead to incorrect laboratory examination results, list contents that should be included in a handbook designed for people who collect samples off-site, provide a rationale for rejecting unsatisfactory samples, describe a system for sample handling, including collection, transport, storage, and disposal, and explain the importance of maintaining sample integrity and assuring that all regulations and requirements are met when transporting samples. The laboratory testing process from the pre-analytical, analytical to the post-analytical phase is controlled by having checks and balances along the way. This is very important that every step from the pre-analytical, that is before the samples arrive in the lab, and the preparations that we do in the lab before receiving the sample, and the analytical phase when we analyze the sample, to the post-analytical phase when we read the results and we interpret the results, review the results, and sign them off, are controlled by having checks and balances. Validation and verification of methods, as well as internal quality control, are some of the measures in place to ensure that the processes deliver the best outcomes for the patient. And we are going to discuss all of these steps in greater detail in this podcast and the other three podcasts to follow this. So as usual, let's lay out a scenario. And our scenario today is that your lab has performed PCR for influenza virus on patient samples from Clinic A. Your lab has performed PCR for influenza virus on patient samples from Clinic A. Most of these results are negative. Most of these results are negative. The medical staff from Clinic A tells you that their patients present all the clinical signs of influenza. The medical staff from Clinic A tells you that their patient present all the clinical signs of influenza. So the question is, what are you going to check? What will you do? What are you going to check and what will you do? So as I said, that the result of any lab examination is only as good as the sample received in the laboratory. And this goes to the mantra of garbage in, garbage out. If the sample is not good, the results will not be good. So a lot of factors and consideration need to go into place for us to be able to get good results at the end of the analytical phase. So the elements of good sample management are essential to accurate laboratory diagnosis. They also influence therapeutic decisions, as we know that more than 70% of all the therapeutic decisions that are done are influenced by the laboratory results. So we want to make sure that the clinical staff get the correct results, and not only correct results, but on time, to be able to influence patient care and management. Good sample management also directly affects patient care and outcome and influences laboratory efficiency. We are going to look at this in greater detail. Now, the first thing that we want to do is have a laboratory handbook, which defines the policies and practices, things like the quality lab test order form, and we're going to look at this in detail just a few minutes from now. The information that is needed, the collection and preservation of the samples, sample labeling, assessing, processing, and tracking of samples. This is critical. If, for example, your lab is designated as a forensics lab or a drug testing lab, then, for example, for the Football Association or Athletics Association, anti-doping lab, you want to make sure that you perform the tracking properly, that the samples can be traced back to the individual people. This lab book also defines the policies and practices on retention, storage, and disposal of samples, and how the samples are transported, uh, whether by air, cargo only, or mixed cargo, passenger, or by courier, or by specialized transportation. All of those are defined in the laboratory handbook, which must be available to the sample test requesters. So the laboratory handbook, if we look at this in more detail, contains information needed by those who collect samples. They want to know which samples are available to all sample collection areas, at what time, what place, how. This lab handbook must be understood by all laboratory staff and referenced in the quality manual. The contents of the lab handbook are things like name and address of the laboratory must be able to be identified by all the end users of the laboratory and sample collectors. They must know the name of the laboratory, the physical address of the laboratory, because for obvious reasons, we don't send samples through the post office box, so there has to be a definite way for these samples to be able to arrive at the laboratory. The contact names and telephone numbers, hours of operation, is the lab open 24/7, 365, or it's open from 8 to 5, 8 a.m. to 5 p.m. in the afternoon, or it's open 24 hours a day, 5 days a week, whatever the operation hours of the laboratory, they must be included there. And also the list of tests that can be ordered. Please ensure that the tests that can be ordered are clearly delineated in the laboratory handbook. And if for one reason or the other, that we will discuss later, a test has been stopped, then an addendum has to be added to the lab handbook, indicating that that test is not available and for how long it will not be available. Another thing that needs to be there is the sample collection procedures, sample transport procedures, expected turnaround times. Please ensure that your laboratory adheres to these TATs, and how urgent requests are handled. Some of these requests, like for example, CSF cell count, CSF culture, and blood grouping and cross-matching are critical tests. And you must define very clearly how these requests are handled in your laboratory. Some of the responsibilities of the lab, as far as sample manager concerned, are we must provide sample collection information, what sample is collected, when is it collected, how is it collected. We must give this to either the nursing staff or the other clinical staff on how exactly this is being done. And we must also provide appropriate containers and supplies, the purple tops, the red tops, the syringes, the sterile containers, and the labels and the packing materials, clearly indicating which sample goes where and which label. And also define a good labeling system. Is it going to be handwritten? I recommend that we avoid this as much as possible. I am a big fan of barcode systems because that is either eliminates or reduces handwriting errors to the barest minimum or completely eliminates it. And also assess all samples pre-examination. Now, the typical test requisition form has got the test center and the address and the test requested, the patient's name or home address, time and date of sample collection, source of sample when appropriate, clinical data where indicated. We don't want all of the clinical data of the patient, but just to indicate, cholera suspected. That helps the lab to determine the test that will be done. Contact information of the requesting physician or authorized individual must also be included, including the phone number. And the patient's ID is also critical. If it's an infant, for example, then you want to include the birth date, the birth weight, and the hospital and the physical address, whether it's the pediatric critical care unit or neonatal intensive care unit, or pediatric ward, adult ward, whatever the ward is, it should be indicated in the test requisition form. If it's a field data collection form, then it must have a tracking record number indicating when the unique ID number, when the sample was collected, who collected it, the driver, the time of collection, the clinical diagnosis, the health status when the specimen was collected, the handing over form to the courier or the driver, and the time when it was received in the laboratory, in what condition it was received. All of these need to be included in the tracking form, because for obvious reasons, like I indicated earlier, if your lab is handling, for example, forensic samples, you want to make sure that the results are ascribed to the right person. So this is on top of other information like the general patient information, the name, the address, the county, the country, the city, the town, the village, estate, house number, street, all of that need to be included. The name of the person completing the form needs to be included there, institutional affiliation, contact details, and the date in terms of the day, month, and year, or the style that is normally used in your place. I should emphasize here that, for example, in Africa, we have a country like Ethiopia, which has got the Ethiopian calendar and the Gregorian calendar. All of us, the rest of the world, we use the Gregorian calendar, apart from the Muslim world. So in Ethiopia, you can have three dates, the Islamic date, the Ethiopian calendar, or the Gregorian calendar. So it has to be clear to everybody, from the sample collector to the lab, which calendar is being used. Otherwise, there'll be total chaos. So the collection requirements that must be in place, critically, is the patient preparation. Identify the right patient, that is the patient from whose sample is going to be collected, the type of sample required, the type of container needed, labeling, special handling instructions, and safety precautions. And it has to be clear that all biological samples have to be treated and handled as if they are infectious. We must provide the sample collection information, like the collection supplies, provision of the hand, which finger is going to be pricked, for example, how it's going to be pricked, the preparation of the skin. All of that need to be provided, that information. And if after taking the needle, the blood spot, how do you transfer it, for example, to the container? How do you dispose of the sample collection materials in a safe way? In labeling, each sample should be labeled with the patient's name, patient's unique ID number, the test ordered, the time and date of collection, and collector's initials. Again, let me give the example of a country like Uganda, where some of the names are not gender specific. Like the name of Grace could be either male or female. So if you're in that kind of situation, maybe you need one more box to check whether it's male or it's female, because some of the tests that we do in the lab are gender specific. Again, I would like to encourage that we use computer-generated barcodes as much as possible, so that we avoid handwritten labels which are prone to error. And if we make this kind of errors, then we know what might happen. The wrong patient might receive the right results, and with all the attendant issues. Now, let me give an experience that I had, not personally, but in this health facility that I visited years ago. There was in the lab the blood grouping and cross-matching bench, and the sample came in. They handled the sample well. On the testing bench, the technician decided that the sample was not good, and she requested for another sample. This sample was brought, and when she did the grouping, it was a different blood group. And she said, wait a minute, something is not adding up here. So she went herself to the ward, to the emergency ward, and she got another sample. And this sample was another group altogether. So 3 blood samples with 3 different blood groups. She said, how come? The patient's name was Raphael. So she said, definitely these things are not adding up. She went back, and lo and behold, there were 2 Raphaels. 2 patients named Raphael. Both of them were involved in a motor vehicle traffic accident, and both of them were in the emergency ward. Both of them required blood transfusion. So 2 Raphaels with 2 different blood groups. If this technician did not take the initiative to go and check herself, you can guess what would have happened. The wrong Raphael receiving the wrong result, and that can be fatal. So we want to make sure that the right samples are collected from the right patient, handled in the right way, tested, and the right results taken back to the right person. You may look at simple things like a pregnancy test, and samples have been switched, and one person who is truly pregnant received HCG negative, and the other one receives a positive when the samples have been switched. And all the trauma that can be attendant to this are just too bad to even imagine. So some of the outcomes of improper collection, like I've indicated, are delays in reporting test results, unnecessary redraws or retests, decreased customer satisfaction with your laboratory, increased costs both for the lab, for the institution, and for the patient, incorrect diagnosis and incorrect treatment, injury, and death. So let us look briefly at the pre-examination steps. The first thing that we must do is to verify the completeness of the test request, appropriateness of sample, and information on the label. Are all these on the request form and on the container? Then record in register or log, whether you're using a barcode scanner or you've got a paper log, and then enforce sample rejection criteria. Now, let me just put a caution here that depending on the sample, it may be a bit tricky to reject some of the samples. Because, for example, if they are postmortem samples and the deceased has already been buried, so when you reject that sample, they cannot go back and take out the body from the grave to get another sample, unless it is a criminal case. But you want to make sure that the sample that you got is as good as you are defined in your laboratory handbook. And as I will show you in a few minutes, that sometimes we may be forced to process suboptimal samples. So make sure that in the container, there are label samples with the completed requisitions. And if sample has been spilled, for example, it's a urine sample or a blood sample, there is spillage, this is a cause for rejection. Because if you got multiple samples, then it means that there has been mixture of the samples, and you will not be able to differentiate the samples after they have been contaminated, and the results would not be a true indication of the biological events happening in the body of the patient. So the actions required for rejected sample. So you've decided to reject a sample. You must make sure that the section head, the lab manager, and ultimately the lab director are informed that this sample has been rejected. And then after you have informed them, the designated person, either the lab director or the lab manager, will inform the authorized person that the sample has been rejected, and whether there is a need for another sample, which you go ahead and request. Record the rejected samples, and you should have a log in the lab of the samples rejected from whom they are being rejected. These would help in the review. Is it a particular individual sample collector who has got a problem? You should be able to trace where this problem could be coming from, and retain the rejected sample based on the preset criteria. How long you're going to retain it, where you're going to retain it, and how you're going to keep it is extremely important to define all of that. And as I said a few minutes ago, that extraordinary circumstances may require testing suboptimal samples, like, for example, forensic samples, or if you're doing mortality surveillance, once the body has been disposed of, then it may not be possible to get the sample again. So you should have a sample register or a log, and now it's less expensive to have a computer, so have an Excel sheet, very easy. That's how in my former lab we started out. When we did not have a lab information management system, we had an Excel spreadsheet where we input the information, and those spreadsheets are user password protected, so that people, even when they change them, then we are able to track the deletions and the additions and the corrections. So the register should include date and time of collection, date and time of receipt of the sample, what is the sample type, the patient name, the demographics required, and the lab assigned identification, and also the test to be performed. So I indicated that there should be a tracking form, whether for forensic purposes or just routine tracking, but we want to know where are these samples coming from, how long has it taken for these samples to arrive in our laboratory, and who has handled them, so that if there is any need to perform any corrective procedures or preventative procedures, then we know exactly where to start from. So we need to confirm the receipt of the samples, including the date and time, label samples appropriately, have they been labeled appropriately, and have they been kept with the test requisition until lab ID has been assigned, and also tracking of the aliquots should be traceable to the original sample. Has aliquoting been performed at the sample collection site, or is going to be performed at the reception desk in the lab or in the testing area? This is extremely important, that all of this information should be available. If it's the sample tracking computer and you have a lab information management system, great. But if you don't have that, as I said, you can have Excel, you can have REDCap, or any other bespoke system in your computer, and the database entries should include the following: the identification number, the patient information, the collection date and time, the type of sample, the test to be performed, name of the healthcare provider, location of the patient, for example, the ward, the clinic, whether it's outpatient, whether it's emergency ward, wherever it is, or it's a walking patient. All of this need to be included in the tracking computer. The diagnostic test results, the time and date results are reported. These last two will aid in determining the turnaround time. We must handle all samples as if infectious. Do not assume, and I've seen, people walking in with red tops, and they're just handling them without any gloves, and they say, oh, I know this patient, oh, I took care of myself. No. I will, in another podcast, show you how people have died from lab infections. People die. People get infected in the lab and people die. Please observe universal precautions and handle all samples as if they are infectious. Now, you have processed the sample, and you have a policy on sample storage. This must be a written policy, not a word of mouth. This must describe samples to be stored, and was there a need to get informed consent from the person whose sample was collected? Determine the retention time, how long, how many years the samples are going to be stored, where are these samples going to be stored, describe the proper conditions of storage, and establish method of organizing the samples so that in an audit, whether internal or external, you are able, just by picking up the lab request form or the lab information management system or the Excel or the paper log, you should be able to trace exactly in which freezer, in which compartment, in which box, in which tray, box number and position that sample is. Should be very easy to trace that. And set the policy for retention. How long, as I indicated, how long the samples are going to be retained. If the samples are going to be shipped to another lab, either in country or outside the country, this must also be clearly defined. And the person whose sample has been collected must have indicated whether they agree for their sample to be retained or their sample to be shipped, either internally or externally. Monitor the stored samples, including the freeze-thaw samples. For example, if you're collecting PBMC, they are affected by the number of freeze-thaws. Any sample will be affected. If you take it out from minus 80 and bring it to room temperature, the matrix of the sample is going to change. Maintain an organized, accessible system. Not everybody should be able to access where the sample storage area. People will not like you for that, but as I always say, you're not there to be liked by people. You're there to run a lab and run it to the best international standards possible. Establish a schedule to review all stored samples. You cannot, obviously, for obvious reasons, review this daily. This could be monthly or quarterly or 6 monthly or annually, and establish tracking procedures. Now, when you're referring a sample to another lab or for testing or for archiving, you must have a record and define this as a written policy on the samples to be referred, the date of referral, the name of person referring the test. Not everybody in the lab should be able to refer the test. This should be the lab director or the designee to refer these samples for either archiving or for testing in another lab. And then monitor, track, and record the turnaround time from the time the samples have left your lab to the time the results have been received in your laboratory, and also to the time that the results have been delivered to the test requester. If there are problems with the referral system, this must also be recorded so that when you're doing your evaluation, you are able to justify either changing the reference lab or retaining them, depending on their performance in the review period. If, on the other hand, samples are supposed to be disposed of, there must be a policy for sample disposal which is in compliance with local and country regulations. Do not do anything that is outside the local and country requirements. And also the disinfection procedures before the samples leave the lab. Are you allowed to dispose of these samples in the municipal waste, or they should be incinerated? Ideally, every laboratory facility should have an incinerator where, after the safe disinfection of the samples, they are disposed of in the incinerator. And in sample transport, we want to make sure that we maintain the integrity of the sample in terms of temperature. I said in a previous podcast that we should have data loggers in the container to keep track of the temperature changes, and also ensure that the preservation of the samples has been done the way we want it, and that we want special transport containers, whether it's dry ice, whether it's just cool packs or room temperature, whatever way that the samples are supposed to be transported, we must be able to define. And also the time limitation from the time that the sample has been collected to the time that the sample should arrive in the testing area, and assure the safety of the sample. Now, where do these come from, the transport regulations? and who develops them. These are either developed by the National Transport Regulations or IATA. In all my labs, we have used the IATA regulations as the de facto regulations that we fall back on. And also, they are different whether we use rail or road or sea transport and postal services. All of these, whether private couriers, all of them have got their requirements, and these will be defined very well. And ensure that you comply with the requirements. I always insist that my staff take the IATA test for the transportation of dangerous goods, because if we do not comply with these requirements and we violate them, then it can lead to very hefty fines or the closure of the laboratory. We should be able to deal also with accident and spills and reduce biohazards or eliminate them completely. And also ensure that we comply with the safety requirements for the couriers and for the laboratory staff, passengers, and carriers. This we must ensure that it's been done. Now, different infectious substances are classified differently, and these classifications, like the one that we used, which came into force in 2005, are based on two transport categories. Category A, which is for infectious substances capable of causing permanent disability or life-threatening or fatal disease to humans or both human and animals. The packaging required for this is that most durable triple packaging with full dangerous goods documentation is a must. So triple packaging. The primary container, the secondary container, and the shipping container must be in place. And as I indicated a few moments ago, the training of transport staff and the laboratory staff is a must. And these training documentation must be filed and should be accessible and available during audit, both internal and external. The other category is category B, infectious substances, and these substances are not included in category A. They require less stringent triple packaging, and they do not require dangerous goods documentation. There are exemptions, and these exemptions are those substances that do not contain infectious substances, or substances containing organisms that are non-pathogenic, substances containing neutralized or inactivated pathogens, environmental samples that pose no risk of infection, blood or blood components collected for transfusion, tissues or organs cleared for transplantation, dried blood spots, DBS, and fecal organ blood screening tests, and lastly, decontaminated medical or clinical waste. I have adopted this from the 14th edition revised of the UN Model Regulations for Transport of Infectious Substances 2007. You can check this, and if there are newer regulations, then you adopt them for your laboratory. So let's delve into more detail on the triple packaging as defined by the UN regulation of 2007. For the category A substances, we must have a leak-proof primary container, a leak-proof secondary container, and the secondary container must be able to withstand 95 kilopascal pressure test with a rigid outer container, minimum of 100 millimeters. Absorbent material should also be in place with a 9-meter drop test without crashing and 7 kilogram penetration test. The UN marks and label should be in the container, on the outside of the container, with full documentation and training of the transporters. For category B, the leak-proof primary container must be in place. The secondary container must also be leak-proof, and the pressure test is the same as for the category A, that is 95 kilopascals pressure test, a rigid outer container, minimum of 100 millimeter, and then absorbent material, and with 1.2 meter drop test. And the specific UN label, 3373 label, must be affixed to the shipping container. The exempted human or animal specimens should be in leak-proof primary and secondary containers. There should be adequate outer container with a minimum of 100 millimeters thickness and absorbent material in place. So the sample transport must meet all applicable regulations, and as I've emphasized, we must train the personnel in all the transport procedures and assure the sample is protected by temperature, transport time, packaging, and preservation. One of the challenges that I've had is the shipping companies, if you don't manage them well, then they may collect your samples, they will top them up with the dry ice, and then when they reach the destination on a Friday or on a Saturday, meaning that the samples are going to be sitting either at their depot or at the airport for 2 whole days. And maybe at that point, there is no topping up of the dry ice, there is not temperature checking, and so your samples may deteriorate. So you want to agree with the courier companies when the samples should be collected from your laboratory, when they've already booked the airline, so that they move directly from your lab into the cargo hold of the airline and they're shipped out the same day. You want to make sure that that is done as much as possible. It's not easy, but it can be done. Now, in summary, we should provide a laboratory handbook with collection information to all users. We should have a system for tracking samples as they move through the laboratory, establish and implement a policy for sample storage and sample disposal, maintain sample integrity, and assure that all transport regulations and requirements are met. Bottom line, always follow universal precautions and assume that all biological samples are infectious. The key message to take away from this podcast is that the laboratory must have good samples in order to ensure accuracy and reliability of testing and confidence in the results generated by the laboratory. And that sample management directly affects patient care and outcome. Thank you so much. I welcome your comments, as usual, your questions, your concerns. You can reach me at joundo664@gmail.com, joundo664@gmail.com. See you on the other side on another podcast. Thank you.